Okay. I didn't get my kid in time, so I'm kind of making do. My job let me get some stuff from work, so I can use that stuff. This is going to act as my sharps container that, of course, I would have normally if this was a real setting. We got an order today from Miss Millie Larson, date of birth 1/1/36. Looking at the MAR, it is due now. She has no known allergies. Med record 1, 2, 3, 4, 5, 6. She has an order for Docusate 100 milligram. I'm gonna pull it out the drawer. I have 50 milligrams. I'm gonna have to give her 2. And haloperidol 1 milligram per IM or intramuscular. So I have 2 milligram per 2 ml. 4 milligram per 2 ml. So I'm gonna have to have 1 ml. So we got that. Got my alcohol. We're gonna do a 21 gauge 1-inch needle to pull it up. I've got my replacement for after I pull it up. So expiration date, gonna go over that. Expiration date is 6/22. Expiration date is 1/23 on that one. Get outside the room, double checking my MAR, make sure I've got the right thing. I've got 50 milligram, 2 tablets to equal the 100 milligram Docusate. I've got the vial of 4 milligram per 2 ml haloperidol, so I'll need 1. I've got that, that's correct. Got my supplies, my gloves, alcohol, my sharps. So I knock on the door, I go in, I verify that this is Millie Larson, 1/1/36. Hey, Miss Larson, my name is Cynthia. I'm here to give you medicine today. Doctor wants you to have Docusate 100 milligram. Got it right here, Miss Larson. This is your Docusate. It's 50 milligram. So I'm gonna have to give you 2 of them. A lot easier to pop them out. Okay, so give her that. I make sure she's in a high Fowler's position, able to drink. Put it in her mouth. Make sure that's taken and that's done. So, and then I check that off that I gave that. Given CM. Okay, so she's gotten that. Then we're gonna double check. Check again the haloperidol. It's 4 milligrams per 2 ml, so she's only going to need half of that. And I do apologize for having to use my stuff here at home, but this is what I have. This is going to be her thigh, her gluteal area. All right, this is Miss Millie Larson. She is date of birth 1/1/36. The haloperidol. I was always taught to put your gloves on before this, but we don't do that in this one. So I'm gonna pop the top off of that. And scrub that really good. Trash. And we only need 1 milliliter. And this gauge is 21 gauge 1 inch, 21 gauge 1 inch. And I'm just using this one to draw it up with. Oh, sorry. You're not supposed to do any of that. Wipe it off. I got to draw up the 1. insert it. Make sure it's not in the liquid. Insert the air. Dump out the air. Pull up the one. That would be in the sharps. Draw back a little bit to get all the air out the needle. That's in the sharps. All right, and I'm just gonna sit this here because it's still by me. It's still drawn up. It's not contaminated. I'm gonna put my gloves on. Miss Millie, we have to give you an injection, and intramuscular injection. If you can roll to your side, so I can get to your gluteal muscle. Yes, ma'am. It's got to be in the muscle. Can't take this one by mouth. I'm sorry. So you're gonna place your hand on the. You're gonna find the greater trochanter. Trochanter. You're gonna find the spine. That's gonna be your spine. The iliac, anterior superior spine, and the crest. And you're gonna inject it in the middle. That's gonna be your area of injection. So you take and clean it in this area, inner to outer, and you leave your alcohol swab there. And of course, you're always checking your medicine. Intramuscular, we're doing the ventral gluteal muscle, which is that area there. And take my paper off and the cap. Okay. And as I'm doing it, I'm gonna pull tight on the skin and pull it up a little bit because she's an older person, and make sure my liquid is all the way. You want to go all the way. Make sure there's no air, and you're gonna do it at a 90-degree angle. And when you go to do it, you say, Miss Millie, it's gonna be a little stick now, okay? Little stick at a 90-degree angle. You go in all the way to the hub. I pull up a little bit, which pull up, and then you give the whole thing, make sure it's in. And this one, you make sure the cap is done in the sharps container. Make sure she's not bleeding. I'll pat that off. Discard all my trash. Discard all my trash. Make sure she's comfortable. Hand hygiene. Make sure she's in the proper position, or make sure she's comfortable. Just move that out of my way. Make sure she's comfortable. Make sure her collight's in reach. Make sure if she has any questions about what we just did, answer those questions. And then when I get done, of course, I'm on an initial. So I already gave the DocuState and signed off. I'm gonna sign off the halopurinol, and it was in the left gluteal muscle. So injection site is D. Site access before, no. I'm gonna put my initials there also. So that was done. Miss Millie is fine, no issues. You continue to watch her, make sure she's comfortable. Head back down if she won't sit down, call out in position. And that is it. Thank you.